Hi everyone, my name is Elisa Hernandez and I'm here to talk about hepatitis A and Yersinia pesticides. So let's begin. Hepatitis A is caused by a virus that infects the liver cells and causes inflammation. Note in medical terminology, hepat means liver and itis means inflammation. It belongs in the family of the picornurus virus and is classified as the hepatovirus. The general features of Hep A is a non-enveloped icosahedral capsid, meaning a surgical shape, with a single-stranded RNA genome, a positive one. And then within the nucleocapsid, it only has the nucleic acid and proteins. And another name for the nucleocapsid is capsid, which is a protein portion that coats and protects the virus genome. The structure feature has 3 proteins, and it undergoes the lytis cycle. It does not produce a detectable cytopathic effect in infected cells. As you can see here in this picture right here, how the virus goes into the host, it starts binding, and then the second part, the RNA starts uncoding, and the next stage is the translation, and then with the fourth, replication of the RNA. The fifth one is the virion assembly, and then the sixth and final stage is the mature level and release. Now, it is a communicable disease. The reservoir is humans, us. It can be transmitted person to person through fecal and oral route, which is very important that you're washing your hands before and after going to the bathroom, and also before or after eating and preparing food. Now, Hep A is a resilient virus able to exist in soil and other environmental conditions. It remains inactive until a host comes in, which is us. That's why it's very important not to drink any contaminated water or undercooked meats. If the person does develop Hep A, here are the symptoms. You have the fever, malaise, jaundice, anorexia, nausea and vomiting, dark urine, abdominal pain, or discomfort, especially if it's located on the upper right side beneath your lower ribs, which that's where your liver is located. Now, there is a treatment for it, which is a vaccine. There are 2 hepatitis A vaccines, the Vacta and Hyvrix. Depending on the brand that you get, it only requires a two dose. Both of them require 2 doses. So just depending on the brand, you could get it for between 6 to 12 months or 6 to 18 months. Now, it's an inactivated vaccine, meaning that there's no live virus. The vaccine works by stimulating the body to produce antibodies, which are proteins that will fight and kill the virus and prevent hepatitis A infection. There is currently no oral treatment, so the vaccine is the best route, especially for long term. There are mild side effects, soreness at the injection site, headache, and loss of appetite. Now, according to CDC, 33 states have publicly reported the following as of July 25, 2020. So this is just recent. 33 states has been affected. A total of 33,000 cases, and the death rate is 332. Globally, there are an estimate 1.4 million cases of hepatitis A every year. And that normally happens when somebody travels internationally and drinks from the water and eats from the undercooked meats. Now let's talk about Yersinia pestis. They're formerly Pastorella pestis. They are responsible for the Black Death. And there is also a three plagues, which we'll discuss that later. So like I said, it's bacteria. The genus is Yersinia, species Y. pestis, and the family is the Enterobacteriaceae. Now, it can reproduce asexually using a binary fusion. Is a type of cellular division in which each daughter cell receives a copy of a single parent chromosome. Y. pestis maintain in nature through transmission between blood feeding, meaning that the bacteria could survive within the animal, the mammal, and the adult flea, the flea vectors. So the host adult flees to rodents, and the definite hosts are humans. Life stages typically, the bacteria is thought to exist indefinitely in so-called zoonotic cycles that cause little obvious host mortality and involve transmission between particularly resistant rodents and their fleas. As you see in this lovely picture over here, it could live in the liver, in human liver, and it requires blood to survive, and it's passed on by blood transmission, meaning a bite, either from the flea, rodent, or an affected mammal. And it could grow rapidly. It can double in 1.25 hours. The general characteristic of Yersinia pestis, it's gram-negative facultative anaerobic bacterium. Its shape is non-mantle. It has a rod shape and no spores. It has a slime layer. So you see right here. And in it tests negative for urea, lactose fermentation, and indole. As you can see, this example right here, this is the bacteria on blood agar. But I also want to mention that the bacteria survive in cytotoxic digestion of blood plasma through the action of Yersinia marine toxin, YMT, which is a plasma-encoded phospholipase D. As I mentioned before, it comes in three different forms of plague: bubonic plague, symptomatic plague, and the mononic plague. Now let's start with the bubonic one. If a flea bites near the lymph nodes, you can develop a fever, headache, and chills. And if not treated, it could spread to the rest of the body. The symptomatic one is more focused on the circulatory system. The symptoms can include the fever, chills, abdominal pain, shock, and bleeding to skin and organs. The surrounding of the skin becomes necrotic, meaning the skin is dying and turns black. And the final plague, the pneumonic one, the symptoms include fever, chills, weakness, and rapid onset of pneumonia, with secondary symptoms of chest pain, coughing, bloody mucus. This happens if you inhale infectious droplets, or can be if you did not get treated when you had the first symptoms in the bubonic stage, the bubonic plague and the septic plague. So it's very important that you see your provider or go to the emergency room since you develop those symptoms. Now, the antimicrobials or the antibiotics, which is the best of choice to kill this bacteria. They recommend 3 top ones: streptomycin, tricycline, and the chloramphenicol. The top antibiotic will be the streptomycin, what has been the most effective antibiotic to treat the plague. The therapeutic effect may be expected with 30 milligrams per kilo per day in divided doses given intramuscular, meaning it's going to be injected into the muscle, and the full course of the treatment is 10 days. What the antibiotic does, it kills bacteria by compromising the ribosome. Streptomycin is an effective antibiotic because its structure is like the anticodons that will usually bind to the ribosome, meaning they will go in and make sure that the virus doesn't continue growing. It kills it right at the spot. There used to be a vaccine, however, it's no longer available in the United States. Now, there were approximately 1 to 17 cases of the plague per year in the United States between 2000 and 2015. In the pre-antibiotic era, 1900 through 1941, the mortality rate among those who were affected with the plague was 66%. As I mentioned before, this bacteria was responsible for the Black Death. As you can see right here, this was the death rate, 75 to 200 million. And most affected was Eurasia and North Africa, peaking in Europe from 1347 to 1351. There is a prevention. It's very important to use insect repellent if you're working outdoors, camping, or hiking. I also suggest you wear long sleeves, long pants, and boots for coverage. That way that you don't get bitten. Please make sure that your pets, such as your cats or dogs or whatever pet you have at home, that they are not infested with fleas. Treat them as soon as possible if you see one. And also don't allow your dogs or cats to roam free in endemic areas or even sleep on your bed, which is not good. So I want to say thank you everyone for your patience. If you have any questions, please let me know. Again, thank you and have a wonderful day.